proved to be correct. One is masking. Please mask and make sure children also mask. But children very, very less age, below 3, there is a precaution asking them not to be masked because their breathing can be compromised. Make sure the child are maintaining social distancing, and definitely make sure that they're washing their hands appropriately. Not too much of washing, but at least some amount of washing is necessary. And also, I would like to say at this point of time that there is a general anxiety and hesitancy to visit the dentist, to visit the doctor. Yes, it is good not to go to doctors and dentists when the child does not have any issues. But if the child has a problem, please do visit the dentist, because if you anticipate the child is having any kind of decay, it's already started, it is better to treat it at an early age than wait for it to really establish itself. Most of the doctors and dentists have already followed practices. COVID safe practices is already instituted. They are making sure that their patients are asymptomatic. In fact, some of them are even going to the extent of making sure that they bring RT-PCR negative reports when they report to the dental clinics or to the hospitals. So some kind of procedure is already, some kind of protocol is already there. And the infection control practices in all the clinics, dental clinics and hospitals, has really risen to a new high because of this particular transmission of this disease. So it is just ensure when you're going to a dentist, the dentist is following appropriate COVID behavior, and definitely visit. I am sure your child will need that treatment. Do not hesitate and do not delay.
Rightly said, ma'am. We have two other questions from our viewers. Dr. Nagesh Bhandari asks that what about cleaning teeth with finger and paste in small children?
Finger and paste. Finger actually does not serve much of a purpose in cleaning the tooth. You need the brush, and for children and for very young children, we have finger brushes, a small kind of a slip-on kind of a brush with small bristles on which you can put the paste and clean. And if you the main idea of brushing is to disrupt the plaque, the kind of slimy covering over the teeth, and this has to be cleaned throughout. It is not just on the surfaces that are just kind of visible. We have to look at the all the surfaces has to be clean, and this has to be kind of disrupted every 12 hours, so that that buildup does not happen and it does not cause much caries. So that is the reason. So finger brushing may not be very effective. I would suggest the brush and paste.
All right. So Miss Aswini Surendra asks at what age we have to decide if we need braces for kids.
Now, that's a very important question. Thank you, Ms. Ashwini. The braces actually, full-fledged braces is decided based on the child's need. But that doesn't mean that we don't do any kind of braces treatment for very young children. Now, whenever we have a tooth which is lost before its time, say for example, you have a milk molar which is decayed and it cannot be saved and it has to be removed, and we are sure it's going to take another 4 5 years for the next tooth to come in, we put in a small appliance which is called as a space maintainer. Okay, now the space maintainer is very, it's like it has a ring with a small loop in it, and it kind of maintains the space for the next tooth to come. And we also do some small time treatment in children, especially when we have the habits, we give them appliances to make sure that they don't uh, put the thumb. And also we have some treatment in a what we call as an early developing malocclusion. That is when the all this jetting of teeth all starts out very early. By around 7 or 8 years itself, we notice that the permanent teeth are flaring up. We can often institute what we call as some myofunctional therapy to make sure that those teeth go back. So usually whatever problems that we encounter, we can either wait for it to totally develop and go for braces at a little later age, or we can start with small measures that try to reduce it, and probably at a later age you don't need so much of treatment as you would require before.
Wonderful, ma'am. Thank you so much for all your valuable insights on children and their oral hygiene today. Let me summarize what Dr. Lata has just shared with us. To begin with, for good oral hygiene, parents must teach their children to restrict their sugar intake and ensure a healthy balanced diet along with proper hydration to keep cavities away. It is absolutely important to take care of milk teeth, especially to maintain space and ensure the growth of the child. Let your child meet the toothpaste and the toothbrush the last thing in the night. Parents must consult a periodontist for their children's healthy teeth for the prevention of decay and further such dental issues. Dietary counseling, brushing techniques, use of sealants, fluoride application are the golden weapons to fight tooth decay among children. And the best age to see the dentist starts before you plan a baby to avoid further complications like preterm birth. And teach your kids that dentists are indeed their friends. The best diet for an infant is breast milk for at least 6 months. And however, feeding habits must be watched and wipes must be used for your child. Children must be kept away from all harmful habits such as thumb sucking, tongue thrusting, and mouth breathing to keep their teeth intact. And during COVID times, specifically, we must take extra precautions to keep our children safe. To take it a step forward, My Dental Plan as a company ensures easy video consultation features to provide the best possible dental care and support to your children. Thank you so much for joining us today, ma'am.
Thank you so much, Aditi, for that wonderful summary. I wish all the best to all our little tiny tots. And the best message again is stay safe and take care.
Thank you, ma'am. To watch this webinar again and for more such dental insights, please follow our Facebook page or tune into our YouTube channel. Thank you so much, everyone.
Thank you.